Healthcare. A year ago, a Twin Cities woman underwent a life-changing surgery that opened a whole new world for her and gave her back her hearing, the first time in decades that she could hear clearly. We're very pleased to have with us Rian Nelson, the first Healthiest cochlear implant patient, and also joining us is her audiologist, Stephanie Lipke, Dr. Lipke. So we appreciate you both being with us. Thank you so much.
Thank you.
Rian, maybe you can take us back a year ago, almost to the day that we're taping this. What happened?
Yes, it was March 5th last year, and it was a blinding snowstorm that we were coming from the Eden Prairie, Bloomington border, which we didn't think we were ever going to make it because of the icy snow. But we were there, and it was just the most wonderful time to go through this. I'm so pleased that I did it.
You said you started losing your hearing 20s, 30s, something like that?
In my 30s. Mm-hmm.
And then what?
And I was wearing hearing aids. And then the summer of '93, I had a major Meniere's attack, which for about 4 months I did nothing but lay on the couch and whirl and twirl, as I refer to it. So they did 2 different surgeries that summer, and that destroyed the right ear, and consequently the left ear started to go.
You've told me that going into surgery last year, you were really nervous and scared.
I was nervous because I thought, after losing the hearing in the left ear, that if this didn't work, I would be totally deaf. And so it was a scary time, but I just put my faith in, and it came out wonderful. It was a miracle.
And after surgery, then you said that they don't turn it on right away.
No, for 6 weeks you're totally deaf. In my case,
wow.
Totally deaf. And so it made some very interesting conversations. I had a good friend that took me out twice for lunch with a pad and pencil, would show me, and then I'd answer. And but then when they turned it on, it was really. It was just awesome.
You know, we just take it for granted. Dr. Lipke, maybe you can tell us about the cochlear implant that Rian received, and how does it work, and who's a candidate for it?
Certainly. A cochlear implant is for somebody who has lost their hearing to the point where hearing aids can no longer help them. So even with very good hearing aids, Rian was still only understanding about 10% of what was said before her surgery.
Wow.
So she was really using lip reading and even sometimes pad and paper to communicate. So the cochlear implant is for somebody with severe to profound hearing loss with very poor word understanding. There's actually a lot of people out there who are fumbling and working really hard to hear with their hearing aids that could be doing better with an implant. And so there's many people that feel they're not doing well with their hearing aids that could be a candidate that don't know that they are.
So how do they go about finding out if they are a candidate and they should get one of these?
There is a testing procedure that we do for cochlear implantation, and it is done with hearing aids. And it's a series of different tests with words and sentences to test the word recognition for an individual. A cochlear implant is a different type of hearing. So our normal acoustic hearing goes from sound waves in the air to mechanical hearing to then electronic hearing as it moves through the hearing system.
Wow, so complicated.
It is,
complex.
And a cochlear implant bypasses much of that, and specifically the outer hair cell areas of the cochlea that are damaged from hearing loss. In Rian's case, from her Meniere's disease. But some other people from progressive loss, from noise exposure, different environmental things, even hereditary hearing loss. So the implant bypasses that and stimulates the acoustic nerve more directly through electric stimulation, offering a different type of hearing than a hearing aid, but very routinely results in better word understanding. So post-operatively, even 2 weeks after we tested you, because you were doing so fabulous, and she popped right back up to 70%. So it was just amazing.
Wow. So what was it like when they turned it on and you can hear
well,
it for the first
I don't remember who said anything first, but I can remember everything was quiet. There was a lady there from the Cochlear company Dr. Stephanie was there, and another lady, another audiologist, and she had programmed it, and then she said, okay, it's on, and nobody said anything. So I finally said, well, somebody say something, and I don't remember who did, but I said, it's a miracle. I can hear, and you don't sound like Donald Duck.
Why Donald Duck? Is that
So because it's a different type of hearing, the energy, the sound energy is different. So many people say that they have a different type of a sound quality. Donald Duck, I had one patient who said aliens, and that's different, and it's just based on each individual and how their body and their brain interprets the sound from the implant. So luckily, in her case, it was beautiful. And actually, I have to tell a story from when we turned it on. I often try to wait for the family member that's with us to talk first, just so that it's a memorable moment. And so we turned it on, and I kind of paused, and I was looking at her husband, who was also in the room, and they're kind of jokesters. So he may have even made a little joke and mouthed something without voicing.
Oh no, that's a bad joke. That's not a good joke to play.
But no, she's done fabulous ever since.
Well, it's just, it is a miracle for me, because from not being to understand people, what they were telling me over the years, it was just like all of a sudden, and even Dr. Service, who had said, that this may sound like Donald Duck, and when it didn't, I just said, oh, thank God, this is perfect. This is absolutely perfect.
So how has your life changed in this past year then?
Well, it's much better. I have this remote that I can take into restaurants now, and I can focus on the person that's talking to me. I can also make
So
it
kind of
louder or
directional.
softer, and that's a wonderful tool.
And didn't you tell me too that sometimes you do just turn it off?
I
To have
do.
complete
I do.
silence?
A lot of times Sunday morning, my husband watches TV and reads the paper at the same time, and I just don't put it on. I don't even put it on until after I've read the paper. I just like the quietness. But otherwise, jokingly, I can say that I can turn him off anytime I want.
And now you can hear all your children, your grandchildren.
Yes,
and-
yes, it's wonderful. It's wonderful.
Wonderful. So final advice for viewers on if they think this might be an option for them?
I think it's important not ever to settle with your own quality of life and your hearing. So if you feel like you're not doing well, go to your audiologist or seek a second opinion to see if there's something else that might be a better fit for you.
And where can they get more information?
You can always contact us. We are on the Healthy's website for Healthy's Audiology and ENT, or at our phone number, which is 651-232-0707.
And final advice, Rian, that you would give to someone out there who is having some hearing impaired, and what would you say to them?
I would say that you should go and speak to someone who is really involved with the implant surgery, and that not to be afraid. The surgery was very short. I would say 45 minutes to an hour.
A couple hours.
Was it?
Well, for the whole thing, once you get prepped and things, but the actual surgery.
Right,
Yep.
right. And what I would like to stress is there was absolutely not 1 minute of pain. There was no pain involved. I never took pain pills. So don't be afraid of going. It's a wonderful tool, and it makes your life much better, much better.
Wow. And Dr. Lipke, final advice also for our viewers?
Like I said, just seek answers, ask questions, and make sure that you're getting the care that you so deserve.
All right. Well, thank you for coming back and joining us again. And thank you, Rian. It's really been a pleasure to have you with us.
Thank
really
you for
appreciate that
asking.
sharing your story. So thank you.
Thank you.
So still ahead, a cancer survivor shares her personal journey with cancer and what she wants others to know about cancer. But just ahead, the latest medical treatment options for varicose veins when we come back. Thank you so much.
When I have an asthma attack, I feel scared. Sometimes my parents have to take me to the hospital. I feel like a fish with no water.
You know how to react to their asthma attacks. Here's how to prevent them. Visit www.noattacks.org or call your doctor. Because even one attack is one too many.
Welcome back to Inside Healthcare. Vein disease is a common medical condition that can cause varicose veins and spider veins. Healthy's Vascular Center specializes in evaluating and treating vein disease. And we're very pleased to have back with us Dr. Kyle Wahlstrom with the St. Paul Surgeons. Thank you for joining us again. It's been a while since you've been here, so glad to have you back.
Thank you, Jody.
So who is at risk for vein disease and what causes it, first of all, too?
Well, pretty much our whole population is at risk for vein disease,
Really?
and it's actually more prominent than a lot of people think. Actually, about 10 times more prominent than even cardiovascular disease. But it's really usually not diagnosed too early, and people don't usually seek help until they have more advanced problems. So it's usually shows up in people in their 40s to 50s, but a lot of times people will even start to have troubles in their early 20s to 30s.
And what does cause it?
Usually it's related to, first of all, is family history, so the old genetic problem again. So first of all, that. Second is jobs, standing jobs, jobs around your feet, wear and tear. Those are a big two. Third one in women is pregnancies. So pregnancies where we see a lot in young women, 20s and 30s. And even disease that shows up later on will start through pregnancy, issues that come along from that.
So what actually happens when it's, you develop, I mean, you can see the outside, but what's
Right.
happening inside?
So what's happening inside is more about valvular problems. So we all have veins. Veins are tubes that bring blood flow back to our heart. But the veins in our legs are kind of unique. They have valves, kind of like our heart valves, but these are little tiny valves in these tubes in our legs. And they allow one-way flow, so flow up back to our heart. And the difference that happens with our diseased valves is that they break down. So instead of doing this one-way flow, they flow backwards. And it causes pressure to the next valve, which causes that one to break down. So it kind of sequentially progresses over time.
And does it happen in one particular area or is it kind of like the whole leg?
It can happen, you know,
anywhere in the body probably.
Yeah, I have that question asked all the time. Why is my one leg problematic and not my other? And it's just really by chance. There was some theories of right to left, but there really hasn't played out. It just happens, and it happens probably because of a breakdown of a valve higher up causes sequential issues down people's legs.
So you were saying that usually it's not detected early on. So what would be the symptoms? How would you know if you have vein disease?
Well, the biggest thing is people will see veins. So they'll see dilated veins, varicosities, or varicose veins as we call them. They may also see spider veins on their skin. And those are visual cues that people get. Symptomatic cues people will get will pain, achiness, heaviness. And
Like a sharp pain? Or?
Well, it's usually dull pain. It starts with more of dull achiness. And people will talk about it as they progress through their day. They'll get this dull achiness that progresses through the whole day and doesn't get relieved till they get up off their feet at the end of the day. So that's kind of a telltale sign. It may be more so better predictor of problems than actual visualized issues that people have.
Is there anything you can do to prevent them?
There is. The biggest things that we talk about our patients are staying active and exercise. Exercise, like everything else in medicine, is key.
Keeps those valves working?
Yep, keeps those valves. Actually, what it does is it strengthens the surrounding tissue, the connective tissue, which helps them get better return. The other thing that helps a lot is in pregnancy for women or in jobs where you stand all the day long is wearing compression hose or stockings. So that's the biggest key, I think, for helping prevention. The other is catching problems early. I think that a lot of times in our society we've always said, well, if people have veins, just live with them, they'll get better.
Really?
Or you know, they're not as big as issue as you think. But I think getting on top of it earlier is better for people than waiting until they become a big problem.
You know, and I don't know if I really know the difference between the varicose and spider. What's the difference between the veins?
The difference is the spider veins are in the skin level itself, so they're actually a part of the dermis. So they'll actually be these little tiny purple or red lines, very small, usually less than a millimeter in size, and they always kind of look like they emanate from a center. Varicose veins are dilated veins, bigger tubes underneath the skin, which will be those big bulgy things we see. Yeah.
So you have a number of new treatment options that are available. What are some of the latest treatment options available for
Right.
it?
As a vascular surgeon, I always worry about the big problems first. So we look at the whole person first, you know, evaluate them, look for other issues of vascular disease, whether it be arterial and things. But once we do that, our treatments really focus on treating those big issues first. So we'll do an ultrasound to evaluate people's legs first. Once the ultrasound is obtained, if we can do it, we like to do endovenous techniques, which is nowadays we'll use like small catheters put inside broken down vessels. numb them up and seal them right in the clinic instead of doing hospital-based surgical procedures.
So something very simple and
Simple,
short.
yep.
And
That's probably the biggest, newest thing. It's not that new anymore. It's been around now about 12 years, so we've used those techniques. We use either radiofrequency or laser energy to seal those vessels. And it's nice because patients go back to work and life the next day. It's much different than 20 years ago where surgery laid people up for 2 to 3 weeks. We still need surgery, and we still do surgical resections, but it's less and less.
And that's treating the inside problem. What about the visual, the appearance of it? And I
Yeah.
know that that's a concern with a lot of people.
It is, and the two modalities that are treated most often nowadays are laser treatments. So small veins can be treated with lasers, and what it does is it basically ablates that vessel by heating it to a very high temperature.
So it just kind of zaps it?
Kind of zaps it, and it works really nice for people, but it takes multiple treatments and multiple therapies, and it doesn't always just happen overnight. So people have to be kind of set up and ready for that. And in a similar method, we also use scleral therapy, which injects a chemical and causes a chemical reaction or burn to that vessel, which seals it off. And that's also kind of multiple therapies and multiple modalities. Yeah.
What about pain associated with either of the treatments? Or?
There is minimal pain for all of these outpatient kind of clinical-based procedures, usually done with just local anesthetic, or even just as we do for laser treatments, we use cold therapy. So we'll actually kind of almost freeze the tissue area we're working on, and that'll kind of make it so that it's almost anesthetized that way.
So let's say someone is watching this right now. Can they get treated this month, and by summer, varicose veins are gone and their legs are looking great? And
It'd be nice, but insurances have changed now, so most insurances require 3 months of socks to be used before we can actually start treatments. So that kind of delays a lot of people's
really?
treatments. So that's one part.
so maybe by the end of summer?
Maybe by the end of summer. But yeah, it's something that if you want to start to think about the summertime, now is the time to think about it because of that process. Other than that, yeah, we have a bunch of availabilities of clinic positions. We have a vascular center at Maplewood, Woodbury, and also downtown in the Gallery building next to St. Joseph's.
And you're going to have some free screenings or a free screening coming up here?
We do. In April 1st, we'll have a free screening at our Maplewood clinic. What we'll do there is that people can come in, be evaluated by a physician. We'll take a look at your legs, give you some recommendations. We can't actually do as far as book an appointment or things of that sort, but we can do we call a screening where you just take a look, give some options, talk about things that are available, kind of similar to this talk we have in right now, and then give them the materials if they want to come back and take a look at it from a medical standpoint.
And is that something with the ultrasound then that you're doing the screening? Or?
We don't do ultrasounds at the screening, yeah, but we do ultrasounds through the clinic.
So what's the main thing that you want viewers to know about varicose veins or spider veins?
I think the best take-home message is there are things that can be done. I think that treatments should be sought maybe earlier than later because we can do things and make a big difference earlier on. And prevention is the biggest key with exercise and stocking use.
You know, I just thought of too, so if it's not treated, what happens?
If it's not treated, you become one of my chronic patients, which you don't want to be. And ulcers. Ulcers are the biggest thing we see happening, and we all probably know somebody who has chronic lower leg wounds or ulcers, and they're a lot of times related to venous pressure. And that becomes a lifelong problem and a very difficult problem to treat. So we want to get way before that aspect or point of treatment.
All right. Well, it's a pleasure to have you back with us.
Well, thank you
Always
very much.
glad to have you here, so thank you.
Thank you.
Great, good to see you again. Still ahead, a local woman talks about her cancer journey, so stay with us, everyone. Thank you.
Thank you.
So this is my computer.
This is your computer. Let's go on the internet.
Let's go. Click it.
Yes.
Okay.
I cursor in between the R and the E. Pressing dot, I want you to just push the period.
She's gonna love me all over again.
That's it. Jamaica, here you come.
Here we go.
Good job.
Alright. Thank you. Thank you. And I did it by myself. Feel smarter.
Welcome back to Inside Healthcare. Joining us now is Diane Ness, who is a local TV personality and a cancer survivor. So thank you, Diane, for being with us.
Thanks for having me.
Why don't you tell us a little bit about your cancer journey?
Sure. On October 4th of this past year, I was diagnosed with what's called DCIS. It's ductal carcinoma in situ. It's within the milk duct. And that was after several mammograms. And then you wait and you have a biopsy. And then you wait again. And then they found out it was cancer. And I had surgery. In fact, Dr. Wahlstrom, the doctor that was just here, was my surgeon. And he took it out. And then you have to let it heal. And then I met with my radiation oncologist, Dr. Cameron, and we discussed the treatments. And then I finished my treatment, which was radiation, on New Year's Eve.
Wow, what a great way to celebrate the new year.
It was. But I think, Jody, one of the things that I wanted to talk to you about that I spoke to my oncologist about was that early detection. When DCIS first shows up, it's a grain of sand. And because I went in yearly, they had stacks of mammograms from myself. And they were able not to see it, but to compare. That
something was different.
Something was different. And you can't see a grain of sand. You can't feel a grain of sand. Had I let it go a year, my oncologist said it would have been a lump. And at that point, I had stage 1. But at the point that if you let it go, it can go to stage 3 or 4. And then it's too late. So if you catch it early, which I didn't think I had anything. It was just my yearly physical and mammogram. And lo and behold, it was cancer.
Yeah, and it seems like we've gotten conflicting studies in recent years saying, well, women, it doesn't improve your odds or reduce your risk.
Yes, ask me.
Yeah.
It does. I would be in much not as good shape as I am right now. I had it taken out. I had the treatment taken care of, and I'm here to talk about it. And I truly believe in early detection. I know there's arguments for that too, but talk to a cancer survivor, and they'll give you a different answer.
It's not only a physical thing, but it's such an emotional thing too.
It was such an emotional journey. And the waiting was the toughest for me. I tried to stay busy, but you basically wait a week in between each procedure. And that is, you think the worst. 3 o'clock in the mornings are not fun. Fortunately, I had some really great doctors that said, in fact, the radiation oncologist said that, what are you afraid of? And, we would talk, and she said, this is 100% treatable right now. So they ease your pain. But absolutely, most of it is the emotional journey that you take.
You were saying that you wish you knew what you know now, you wish you would have known when you first started this whole journey.
So my first day of radiation, I was a basket case, and we talk about it later. The radiation oncologist and myself talk about it later, and we laugh. We can laugh now because I was such a nervous wreck. You don't know what's behind door number 2 or door number 1 when you walk back to treatment. It's frightening. It's terrifying. It's a very big, thick door, obviously, so that the rays don't go outside of that room. And I had never seen the machine, which is large. But if you've had children, you've had to go through, you walk through the hospital and the labor and delivery room, and you see movies and you know what you're in for. And I talked to her about that, and I said, I didn't know what I was in for. I was terrified. Why can't someone have a movie out on it? Or I even volunteered to go reenact what it's like. Because really, Jody, it's just a very large x-ray machine that comes down on you. And it was so simple. It didn't hurt. It basically was a time. Every day you have to go at the same time. But it basically took 7 minutes of my life every day.
But 5 days a week for how many
however many weeks they decide that you're going to have that on. It's an inconvenience in time. But I didn't know that the first day. And you lay there, and I felt like I was going to hyperventilate. I felt like I was going to...
Well, and you are in the room by yourself, but you can
yes,
hear
you
the
are
voices
by yourself,
of the
and
techs.
you hear them outside. And I think if I'm a visual person, and if I could have seen that beforehand, it would have really eased my worries a lot. And then I was, throughout the whole cancer, I didn't want to talk about it. I just wanted to move on with my life. And that's a struggle too. My daughter kept telling me, you need to sit down and talk about it. And I'm not a talking about feelings kind of person. I had, when I had my biopsy, which was slightly painful, I had it at 10 in the morning, and I was on the ice at 3 o'clock in the afternoon teaching skating, which is what I do. And my son, who I love dearly, couldn't go to work because he couldn't function.
Your son.
So each person handles it differently. I had to stay busy. I had to try to not think about it.
Yeah, because not only are you going through it, but everyone that you know and love it has different experiences.
Right.
And stuff.
And at first I had a very small circle of people that knew about it. I didn't say anything until about 6 weeks in. My family knew about it, and the very close people that I worked with knew about it, and that was it. Then I started to relax about it, and I started to learn more about it, and like you said...
Oh, you even contacted us to say you want to let people know.
Now I know more about it, and I went through it, and now I want to tell people that are in the midst of that it's, do research on it. It's not as terrifying as you think. As my doctor put it, it's not a death sentence. Just figure out the route you're going to go, learn about it, try and see ahead of time what you're in for, and go to the treatment center and look, and then that will help.
Well, it's been a pleasure to have you with us, and
thank you.
Thank you for sharing your
Thank
story.
you.
And I know this isn't the end of it. You'll be doing more, trying to let other people know about it.
I hope if one person is less terrified, then I've accomplished something.
All right. Thanks, Diane.
Thanks,
Appreciate
Jody.
it. And we appreciate you joining us. We hope you'll join us next time on Inside Healthcare. Thank you, everyone. See you then.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.